you're interested in practicing from an intergenerational perspective, this is a good class. Furthering for culturally diverse populations. Why is that so important? Anybody? Anybody?
So many different cultures, anywhere you go.
So many, 198 countries. And inside your circles, inside your administration, inside your practices, and inside those groups, inside your classrooms, are diverse populations of people, right? And they're not going to respond to things, we're not all going to respond to things the same way, right? And just think about it for a minute if you're in a group, right? And you've got 9 different people, and you can't, only thing you know about them is what you see, right? You don't know where they're from, what their culture is, whether it's culturally suitable for them to share with you. You have no idea, right? So these are some things that I'm going to share with you about why this is so important. My narrative in the human service field, you already know my story about being a 2.5 ounce, 2.6 ounce baby girl. I had to figure that thing out. So in my narrative, I started 20 years ago, and most of us start with a problem. What's the problem, right? We want to fix something. Well, in my community, there was a 100-year flood. We never expected it, and I don't know how many of you know Hurricane Floyd. Do you remember?
I was in it. There.
We lost everything. The entire community was wiped. Communities that were beautiful, where children flourished and families lived, lost everything. So here I am in the middle of this community, and we're trying to work with FEMA and figure out how we're going to get the people that are displaced. I got 25 people living in my house, and my house is now being submerged underwater. All of these things are happening, and then you have all of these systems and all of these families, and now you got to figure out what you're going to do. We all had to play a big part in that, right? So we had to figure out how we're going to go from devastation to development. How are we going to fix this, right? Part of that was looking at what we have, right, in our hands. Looking at our children. Juvenile delinquency was going off the chart, right? So my goal, what can I do? What do I have? What do I know? What can I add? How can I add value? So I went steadfast ahead, trying to figure out how I could open up a community center, how I could start at the school, how I could build resources, how I could look at the school system, or partner with governmental agencies, state agencies. Maybe how can we get access? Because we already didn't have any, but now we're worse off because we're destroyed, right? So it became a job. It became like all of you, it became what I do, right? Not for money, for service, for love, for development, right? So went steadfast into that for 20-something years of working with people within our community. So why this integrative approach to care? I'm gonna share, I've already shared, I'm a baby boomer. I love stories. It helps me to share with you the truth about where we're going, right? So as a baby boomer, we're the largest. How many baby boomers in the room? All right. We are the largest population in the history of America. And now we're retiring. They're losing all of this good information from all of these good employers, and we're deciding we're going to retire. Well, I did it a little early. At 55, I decided to take the jump, right? But most of them are 65, some are 70, 75, right? And so what the world did not realize was that who's going to care for these people? Who's going to care for the baby boomers now that they're aging, right? So now we're looking at this huge aging population of people. And so they had to fast track people. Back when I was 19, we also experienced the failing of the mental health system. Anybody remember that when they closed all of the institutions? And what are we looking at now, right? Yes, and so what they decided was that they were going to create these private practices. Private practice wasn't ready for the closing of facilities. They were not able or equipped to address the needs of our people, right? And so they ended up on the streets, homeless, devastated, and many of them ended up incarcerated, right? Bad situation. So in this whole thing of readiness, we lacked the readiness for all of this. So new programs have been created. New children are now going to school at 10th grade. They're hitting these community colleges. They're fast tracking them so that they can become nurses and practitioners and physical therapists and all of this. This is a part of the problem that exists that they did not foresee, right? So now we have all of these children that are leaving school early because we got to get them ready. Got to get them ready to take care of us, right? So alternatives to centuries of tradition. This is what we're looking at. Alternatives to centuries of tradition. And how do we add the value to the customer's experience? Societal ills, we already know, is a multicultural thing, and no one is exempt. You got age, race, sex, gender, ethnicity, illnesses, LGBTQ, individuals, families, communities, and 198 countries. Human services is human services all day, human services all day, right? We're everywhere. We have to care for people. The human services work, who integrates alternatives to practice? We do, and we improve the services. We improve graduation rates, substance abuse recovery, juvenile delinquency, avoidance of domestic violence, child safety, suicide rates, sexual assault, mental illnesses, systems of mass incarceration, reentry, processes of improvement for illness, and so much more. So what do we know, right? How many of you have heard the Johari's window? Right? Johari's window is those 4 little windows where how people process and communicate to us, right? You got this window up here where they share with you. Then you got this window down here where it's hidden. They don't tell nobody about those things, right? All those secrets and those skeletons that are affecting them. And that's how we move. We have to move information from that window to another window so we share with people. Then you have your perception window. That's what people perceive, right? And then you have the unknown. What do we know? Research helps us to understand perceptions and reality, right? And so all of the work that I've ever done has piqued my interest into answering very, very important questions. And for me, it's about how do I take my work as a human service practitioner, the love for helping other people, into this other love that I've always had for technology, right? So what I do is at the intersection of that, human services and technology, and bridging the gap so that we can improve the processes. What do we know? We are a society of ills, and those problems have amplified. Solutions have been traditional. What works for some may not work for others. Technology offers support. It offers support. Technology can bring movements together in seconds. How many of us witnessed that with Gonzalez and the young children who decided that they, in a few weeks, was it a few weeks? A month? Maybe 1 month. They gathered millions all over this country using technology. They said, we won't back down. You will hear us, and change will be made. And they did it using technology, right? So this thing is important, right? They're the Zens. I'm the boomer. What about the Xers, the Ys, and the millennials? I coined this thing, Boom X Y Ennial Zen. You'll catch that on the way home. So what do we have? Traditions of social support in review. In research, This is what it looks like. It constructs social support as either structural, which is the social network, functional, which is instrumental, or expressive of physical support that encourages emotional exchange, or the nature of support that is empirical. So here's my question. We know how it has impacted the user, the end user, the person who needs to recover, right? Because that's what I chose, recovery, to look at. But we don't know how the facilitators feel. That's you guys, right? So my interest, since I couldn't get to the vulnerable population, they don't like us to use that word anymore, according to our Oval Office, but they were vulnerable. You can't just do research on individuals who are struggling. You can't. That's vulnerable. That makes them vulnerable to our research, right? So I said, well, let me go find out what the facilitators think, right? Let me go see if they're using it. And so there was this pilot study that went on by this gentleman named David Gustafson. He's an amazing professor out of the University of Wisconsin. And I discovered him by looking at what was already available, what literature was already out there, and what value could I add by looking at technology. And this individual he started this whole center for health enhancement system studies. This is all they do, is research on technology and incorporating technology into practice. And so I called him. How many of you know you got to just be bold? I said, well, I'm going to call him because I want this. I see all his qualitative studies, quantitative studies. Quantitative studies are about numbers, lots and lots and lots of numbers. Well, I'm in the business of uplifting the voices of others. And so what does that mean? Qualitative. I got to talk to you. I got to figure out what you're thinking. Right? So he says, oh, that would be cool because no one's done a qualitative study. So I chose to do that. Here's some of the things that I found along the way. Integrative trends. We all know with the advent of the internet began in 1991. It has been advancing ever since, right? But in 2008, a shift occurred in social and community services because of millions of online users. According to Pew Internet Project research, right? Internet-based interventions became increasingly popular. But I had to figure out, okay, well, what theoretical perspective am I going to use? There are tons of them, right? And certainly there's something about online when you see all these online communities just growing and cropping up everywhere, right? Forum after forum after forum. And now we got Facebook and Instagram and all of these amazing platforms, right, that are still using, a lot of them are being used to still communicate with individuals who struggle. Why do I know? Because I'm in one of the largest groups on Facebook called for addiction relapse, right? It's about 80-something thousand people in that group. I go in there just to support them, right? Did you know that was there? Oh yeah, they're there. They're there, okay? It's a Facebook group for addiction recovery. There's so many amazing groups out here, but we're going to talk a little bit about that. So I went in to look into this online social support theory, and here's what it said. Cognitive, perceptual, and transactional processes of initiating, participating in, and developing electronic interactions or means of electronic interactions to seek beneficial outcome in healthcare status, perceived health, or psychosocial processing ability. All right, I'm not going to be before you much longer. This is what y'all know most of this. We went from there to telephone counseling. How many of you telephone counsel? Anybody ever pick up a phone and counsel someone? Well, that's happened. We went from the big old phone to the telephone counseling, and then we went from there to email chat. Y'all know about this, right? Then we went from email communicating. At some point email was developed, right? So we went to that. Then we went to these little chat spaces, these little chat rooms, online support. They're everywhere, right? So you chat. This one showed less favorable results when I was studying. consumer versus group therapy, but increased efficacy for the caregiver. That would be someone who's taking care of someone else. Less for the person who's suffering. All right, so then you had your online groups and forums that were developing. Extended the target specific opportunities to offer group facilitation. How many of you have even considered having a group online? Have you? There's some amazing ways to do that, right? Again, they're already out there. But if you are a practitioner, if you are someone who is working with a small population of people, this is also feasible for you as well. You know, you of course have to have policies in place and things like that that keep you safe, right? Then we went to video, face to face. See, in the human service field, there once upon a time, they didn't want this. They didn't think that this was a really cool idea. They saw it as being non-humanistic, but yet we're all on these smartphones, right? We see people, we chat with people, we see our families, phones, right? But we went to video. So now how many of you are part of a doctor's, have heard of See a Doctor Online? I see Doctor Online. Every single one of your insurance companies probably offer an MD option where you see a doctor right in your house. So that's what video is doing, right? All right, so we went to that. Then we had what was called a mobile application revolution, right? So it's app city everywhere, right? You have to upgrade just to keep up with the apps, right? But they are a vital part of what we do now, and a vital part of the structure and systems that millennials and Zens participate in. But I'm not going to limit it to that. The reason being is because I have a 75-year-old mother, right, who is aging continuously, and she is suffering with Alzheimer's, right? Well, what are some things that are really good for Alzheimer patients? Somebody throw something out there for me. No.
Family.
Wait a minute, say it again.
Family.
Family.
Crosswords.
Huh?
Crosswords.
Crosswords. What else?
Someone said music.
Somebody said music. What else?
Routine.
All of this is important. Routine. Bigger phones. Bigger numbers. Right? But they need to be doing something to keep their crystallized memory going. Right? So what about the games? Did you know those were cool things for people with Alzheimer's? When they
use the Wii's and stuff like that.
all of that. So what's one game that you can find on every single computer that you buy?
Solitaire.
Solitaire. Right? My 80-something-year-old mother-in-law, that's all she does all day. Solitaire. But she drives. Her memory better than mine. She will park in front of the hospital and get out and act like that's where she's supposed to park. But these are the things that she does that are improving and keeping her living and going, and her memory and her mind going. And this is serious stuff. We all know, and our textbook told us this. But how are we using our technology now to continue to improve their lives, right? So consider those things when you leave this room. Take these things away with you and know that they're working. So mobile apps emerged to address the needs of real-time support for those in crisis, but I gave you some other examples of how we can use it as well. So here are the trends. Current. 91% of adults own a cell phone. 170 million tablet users, expected to soar to 185 million by 2020. It's not going anywhere. It's going to broaden. 7.3 billion mobile subscribers, expected to soar to 9.1 billion. 81% of millennials use mobile for everything. including work, right? It's the life we live. So, I coined a new theory off of the online social support theory. This is called mobile social support, hence the word and the language for this particular discussion. Somebody give me a time check. Like, am I okay?
2:30.
Oh, I'm doing good. Okay, so I conceptualized this theory, or this theory that I'm coining as mobile social support is the process of using technology to improve the culture of health and human service access through HIPAA compliant, self-monitoring, and real-time support between providers and consumers. That's a lot to digest, but that's exactly what this means, right? We're going to extend ourselves a little bit more. So I looked a little bit more into this HS system and looked at the overview, the need, and the details of this program. In the overview, what it generally does is it delivers support through a smartphone versus a computer. It focuses on helping individuals that are leaving residential treatment to step down into their community with information and other resources needed to maintain sobriety. Because how many of you know that you can or have had a loved one that was in detox? They leave detox with broken systems, no support, no place to go, can't find a meeting makers meet, what they say? Meeting makers make it, something like that, right? Where are the meetings, right? How are they getting there? What if they're in the rural community? What about transportation? What about the financial woes that we're in that's keeping us from offering services? What about all those cuts, right? So what can we do to make it work? Improve competence, relatedness, and autonomy to reduce the risk of individuals relapsing. That's the whole point. How can we make it better, right? All right, so the need centered around this whole project for Dr. Gustafson was chronic relapse, diminished quality of life, all these things I've just mentioned in a very different way, deteriorated relationships. It's a burden on our society to have this to continue this way. Crime rates, healthcare costs, right? How many individuals are going through these systems that have no insurance, right? That is a burden on our administration, or our hospital administration. Who's paying that? Who's paying for these services, right? Then there's the reduced productivity of each citizen. In detail, the program allows for wider access. We talked about audio literacy challenges, or how about readability challenges? For me, it was readability, but for some, it meets their needs when it comes to audio. They need to listen. Tailored to relapse prevention. So what that simply means is the program can be tailored for that individual. They put in specifics about who they are, where they travel, what their problem is, and they get geo-fenced. Geo-fenced into a place and know that they're about to enter a space that may not be so good for them. And what it's going to do is going to send off a siren. And it's going to send off an alert to that counselor who's working with that consumer that, hey, maybe I better pop in. Or maybe I better send them a little something, right? It's all about improvement. Communication with peers. Within this system, they have a group. Remember we talked about groups? They literally have people they can connect with and that are relatable, right? And so at any time, they have their numbers right there. They can contact them. Y'all heard of this program. It used to be called a sponsor. And this program is a system of support and providers, right? Communication with their peers and a system of support with providers. It also helps for monitoring to assess risk. What do I mean by that? That's you and I. When we're working with our consumers, and for a week long, they have these check-ins, we monitor what they're doing, and all of this information that is in this system is HIPAA compliant directly to your office. So you go in the morning, and you might have a routine. Now you checking to see how every one of your clients doing, just by looking at some analytics, right? Would that not help your caseload? Especially when the work that you do is so cumbersome and the caseload so heavy, right? How do we improve not only the culture of access for our clients, but how do we improve the services for what we do as well, all right? So that's how you can monitor their risk, tailor-make their plans, and then you have these one-touch communications with care. Panic button. It's called a panic button. They push that button, and they're right there at you. Now, they may not be at you, but maybe you have a staff call system, within your provider's program. I'm not talking about a 1-800